bank staff in this tough situation. And in continuation, we would like to invite Dr. Namrata Sharma for her presentation on status of banking in India in the COVID era. Dr. Namrata Sharma, for you.
Thank you, Rajesh. I'll be talking to you about the iBanking way forward, as well as the guidelines which were released by the All India Ophthalmological Society and iBank Association of India. And this was version 2 in June 2020. And I think the dictum of this was that the ophthalmology will not change, so you can't change your practices as such, but the way we are doing it will change. So we have to adapt to it. This was the guidelines which was released, which was a 104-page book on different aspects of ophthalmology with 225 plus experts, 20 Zoom meetings, and 13 subspecialty societies. So these are glimpses of those meetings. And we involved every single subspecialty society, and particularly for cornea and eye banking, we had Eye Bank Association of India, Indian Society of Cornea and Keratorefractive Surgeons, and Cornea Society of India. In each of the subjects the guidelines was done, and we are very fortunate that we did have representation from Vision 2020 as well as from the National Program for Control of Blindness. And we would again like to thank Dr. Pramila Gupta and Dr. Rajiv Garg for being with us even during those times and being with us even today. And I think collectively we would like to, of course, within the safety realms, we would like to request them to look into this voluntary eye donation program, at least in some places. So the guidelines for the various surgeries are in place, and this is the group which looked into the cornea and eye banking guidelines and delved into it, and then suggested suggestions. This has also been published in Indian Journal of Ophthalmology. The Eye Bank Association of India recommended that the collection of a nasal swab of diseased donor for RT-PCR COVID-19 is at the discretion of the medical director, and technicians and relevant staff must be given training about the PPE use and other precautions during retrieval to reduce the risk of acquiring infection. And although these guidelines were there, they are advisory, but each eye bank should monitor and consult their local THOTA, NOTO, SOTO, ROTO, State Health Authority, NPCB, and their instructions from the local state government for starting the services. Exclusion criteria is like everywhere. If the disease has been tested positive for COVID-19, or there is history of fever, or the symptom which is of COVID-19, such as cough, shortness of breath, unexplained fever, diarrhea, loss of smell, loss of smell and loss of taste, and individuals who have been exposed to confirmed or suspected COVID-19 within the last 14 days. Then any evidence of conjunctivitis in the past, if you are in the red zone or living in the red zone area of the zone defined by the Ministry of Health and Family Welfare, and if there's any history of ARDS, pneumonia, or CT scan showing ground glass opacities. Because these are the symptoms for people who have to do the screening, especially our eye donation counselors who would go and screen the diseased for these symptoms. Then this is the algorithm that we have suggested that we follow, and again this is published. And I would like to thank both Rakhi as well as Dr. Sharon D'Souza, who's also with us here today, who helped to uh, in the formation of these guidelines. So whenever you have a diseased donor in the hospital and confirmed case of COVID-19, or exposed to confirmed case of COVID-19 in the last 28 days, or lived or has visited any affected area within the previous 28 days, one has to assess the clinical situation. And if there is evidence that it is associated with COVID-19, the donation does not proceed. But if the symptoms are not there and the screening for SARS-CoV-19 is positive or is inconclusive, again, the donation doesn't proceed. And the donation only proceeds when there's no epidemiological risk, there's no clinical situation which is compatible with COVID-19, then only one can proceed with the donation. These are the urgency-wise list of the corneal procedures. This have been modified from the RANSCO chart, which was shown. Emergency procedures, semi-emergency, and the elective procedures which have to be taken. This is courtesy of Eye Bank Society of Rajasthan and the Shroff Charity Eye Hospital. We are thankful to Dr. Swati Tomar and Dr. Manisha Acharya for this. And this is essentially how the training of the eye banking staff has to be done in terms of wearing the PPE. this is, and I think this is something which we need to do at all, in all the zones. And Dr. G. Mukherjee sir has promised that this kind of a training module would be started for all the 5 zones. General functioning guidelines is, of course, we know that in India, a lot of places are there where enucleation has been the mode of collection of the corneas and the corneoscleral rims. But we would recommend that only corneoscleral rim excision be performed and avoid whole eyeball enucleation. Uh, Cornisol has done a great job from Orolab, intermediate preservative media. It's been extremely useful for prolonged preservation of the donor corneas. And of course, if not utilized, the corneas have been shifted to glycerol also. Recovery procedures mandatory require double contact of povidone iodine to ocular tissue before retrieval. And this needs to be emphasized that double contact time povidone iodine should be done in all cases, because povidone iodine kills the virus. Also, the disposable PPE kit has to be worn. The double-layered masks have to be worn with the N95 mask, and they have to be cleaned periodically. The MK bottles, cortisol bottles, flask gel, gel packs, instrument tray, etc., can be cleaned with surgical spirit, alcohol wipes, or freshly prepared sodium hypochlorite after recovery and repeated in the eye bank. And again, all precautions have to be followed. Some people have even recommended UV light in the laminar flow hood for 30 minutes. I do not know if any eye bank has it, but that has been recommended. And we can wash hands, have to wash hands thoroughly, frequently with soap and water. And of course, the Arogya Setu should be on the phones of all the staff who are present in the eye bank. Housekeeping protocol has to be as shown, as is recommended for all hospitals and all clinics. And these are just general steps that when you reach your house, before that only you tell them that you are coming, so that the sanitization procedure can begin outside the house. Wash the hands, and use the tissue and sanitizer, wipe the items placed in the box. And then when you go home, you change after taking a bath, so that your family members are protected from this. This is the declaration or screening form for COVID-19, which was specially designed. This was for the patients, and this was for the, again, for the treatment consent form, to tell the patients that if you undergo a corneal transplantation, they don't blame us later on that this caused COVID-19 infection if they do have it. Of course, all social norms of waiting hall guidelines have to be followed by the patients, whether it is screening desk, registration desk, or patient waiting areas, billing counter, etc. Uh, Similarly, the breath shield for the slit lamp has to be there when you are examining, with proper PPE. And these have to be cleaned appropriately after each patient has been examined, and proper sanitization has to be followed. Again, when you have a negative for SARS coronavirus test, only then the surgery can proceed. And this is something that is being emphasized in our hospital, but I know that this is variable for other hospitals and other centers. And in the operating room, the surgeon wears full PPE, again with the face shield is actually difficult, but maybe goggles for operating. And biomedical waste disposal has to be done appropriately. Post-op care for these patients is done maybe on the initial post-op period on the slit lamp, and later on in teleconsult with the help of teleconsultation. These are the guidelines that we published. Now, as far as coming to the statistics, note that the corneas collected in 2020 versus 2019 in the same period have dropped down immensely, and this is the data from the SightLife India. Then again, the corneas which were transplanted from the SightLife partners have also dropped down drastically in the months of March to June, when the lockdown was announced. And this is from the iBank Association of period during the lockdown period, when obviously no corneas were collected, only therapeutic transplants were being done. Now, we did a AIOS EBI survey and teleconsultation. We found the question was whether teleconsultation or teleophthalmology for patient consultation should be done or not, and almost 68% said that it should be done. Expectation to get back to normal cornea practice, almost 80% said that it will take 3 to 6 months, or even more than 6 months. special training to the iBank staff was being done and was started by almost 80% of the iBanks, and 19% said that they had not yet started it. Then, if you look at the EBI survey, again, collection in the pandemic era, although it started to pick up, but it was not as much as is generally there in the same time during the same period last year. And likewise for tissue distribution also, which was almost one-eighth of what it was during the last time. And this is understandable. The cortisol use has drastically increased by almost 45%. And I remember this figure last year was hardly 16 to 18%. Glycerol is another thing which people were using more. This was not there at all last year. And MK media was a third of cases, and Optisol was also there in some of the places. The nasal swab testing was not being done by 60% of the iBankers, and 13% said that they were doing it, and 26% said that they were not collecting any eyes. And of course, no iBank in India has collected tissue from SARS-CoV-2 positive patient. 35.7% iBanks procured tissue with clear negative COVID-19 diagnosis. Half of them rejected suspicious cases such as donors with respiratory pathologies, and 10% had no collections at all. Surgery only after COVID-19 was being done by 40%. They said they would like to do it, and 37% said that they were not doing it. So again, if you look at the transplant surgeries, they are there, but of course they are much less as compared to what was being done last year. So to conclude, COVID is an enigma. 19 is an enigma globally, and it has led to unprecedented infections and death. I-banking has taken a major hit, and we have to follow the recommendations and follow the guidelines. And as of now, also the advisory from the various governments, state governments, as well as from the government of India.